So when we talked about this, the thinking traps, so you might say to the child, so I see you are not just really good in baseball, but I see you also have great fortune-telling skills. And I tell my students, if you don't have the kids laughing in there, like, it's not good, in my opinion. But I really do believe that things, even when you're suffering, you should be suffering in fun. I'm joking a little bit, but you gotta you gotta try to make, because then they laugh and they realize how absurd some of their maladaptive thinking and behaviors are. So, and then it's like, what do you mean? When then they go, huh? What do you mean? And this is just a template. This is not a script, but it could be, well, I guess I'm wondering what makes you think that because you got a B on your exam, that means that you are going to fail, that's class, and then possibly not graduate. I guess I'm wondering, do you know for sure that that's going to happen? Okay, so help me out now. We're doing group role playing. Help me out. Do you know for sure this is going to happen? Shout out. Shout out.
If I think it will, I'm pretty sure it will.
Well, I guess I'm wondering, has it happened before? Have you gotten B's before?
No.
You never. What do you mean?
This is the first time.
You've always gotten B's? I mean, you've always.
I've gotten A's.
You've gotten A's?
But now if I'm getting a B, then I'm going to fail.
It means you're going to fail.
I was good, now I'm not good.
So you've never had a B before, so now you think because you've gotten a B.
Yeah.
Do you have evidence for that? So for example, do you know what types of grades you need to graduate from Miami-Dade?
All A's?
All A's. Okay, well, maybe we need to go on the internet right now and get some information about that.
Okay.
So why don't we go do that?
Okay.
Okay.
What about C's?
Uh-huh.
I can't graduate with C's.
Mhm.
I don't want to get a C.
Okay, I understand that. I understand. So, and I understand that you want to keep working hard, but I guess I'm also wondering, we also talked about, I also explained to you that sometimes there is this idea of this. Do you remember we talked about this?
I think I get A's.
Okay, oh, now you're doing this. Okay, and I guess I'm wondering, I understand this, but I guess I'm wondering, we talked about, at the very beginning, we've been talking about this a lot. We talked about this idea of messing things up, interfering. So I guess I'm wondering, I understand this is how you feel, but I guess I'm wondering, what is it costing you? Do you understand what I mean by?
I mean, I do. I'm thinking, costing me the A.
Okay, look, this is challenging. Okay,
I'll go for it.
She wants to be nominated.
she wants to be no. No, but this is good. But I don't want to be, but go on.
So, you think the only way to get an A, I'm just wondering if you think the only way to get an A is to worry about it.
No.
So, if you could get A's and be happy too and not worry, would that be good?
I don't like to worry, I like to get A's, so that would be good.
That might be good. So that might be something to work on. Do well academically.
Right, but I got a B.
Okay, so
You got to be. All right.
So Joe, this is good. I like what you're doing.
She did it again.
I'm not. Sorry, Terry. I like what
No,
you're
I'm
doing.
just kidding.
Terry, I like what you're doing. It's good, but no, it's fine. It's good. I just want to just cut in because I want to just take another angle because it's so difficult and it's something so long term, like with the grades and graduating, and because we only have like maybe 14, 15 meetings with the child and we can't like play it all out, it might be a good strategy because you want to like do something that you can actually work with. Maybe what might be good is, look, why don't we think about another area where you feel you always need to be perfect, and let's try not to be perfect, and let's see what happens. Okay, because then you can do something, you know, and get some evidence. So, you know, we can. I'm not going to. I mean, I wish, Barbara, you know, it would be nice if I could. This is now October. It would be nice to work with you all the way till the end of the school year and next year and see what happens with graduating. But I'm sort of hoping we're not going to be seeing each other all that long, because I want you to be able to get a handle on this before you graduate high school or middle school.
Yeah.
So let's.
Yeah. I was just going
So-
for the area of messing it up.
Yeah, it's good.
Because I wonder if she got the B because she
Yeah.
worried so much.
Yeah. No, that was good. I mean, I would keep going there, but I also would like to try to deal, you know, because trying to, you know, what I was saying before, but, you know, convincing them to think your way, it's like, you know, it gets challenging because it's so ingrained, you know, it's so like, this is who they are. It's so like temperamental with some of them. So instead of trying to like get into that, which can work, but then say, well, you know what, I see you really feel really strongly about that. So maybe we should try to deal with something that we could actually experiment with. So let's think of something else, Barbara, besides that you feel like, you know, going on now in your life that you feel that if you are not like this, it will be horrible.
Okay, I like to wash my hair every single day and blow dry it so I look really good.
Yeah.
And I feel like if I don't do that, then I'm gonna have a really bad day.
Okay.
It's gonna kind of.
We've had a lot of kids like this. Do you know that? No, we've had, you know, with the girls, they, you know, I mean, this thing about looking perfect, you know, on like, you know, that they have to look perfect. What's that? Yeah, you know, they think they have to look perfect, and this thing with the hair and looking perfect. And so I've had, so like what we've done with that, when we've had that, I've told like the student who's working with the kid, okay, you know what, next week when you see this kid, make sure your hair looks really bad. No, yeah, because, or you could say, there's two things you could do. One thing you could do is, you know what, you come in next week. What's that? Yeah, because, yeah, exactly. Or you could say, okay, well, you know, if that's what you think, why don't we make an agreement? And this is now an exposure task. I mean, this is a stick task. Okay, today's Monday, I'm going to see you again next Monday. How many days do you want to go between now and next Monday with, you know, how many times would you be willing to give up washing and blow drying your hair? Usually you do it 7 days. Like, so now this is what I would actually do. I mean, I'm very, very concrete. So I would actually go Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Okay, and today's Monday. How many days will you be willing to give up that behavior?
Why should I give up my behavior?
Okay, well,
Explain that to me because
yes,
I like to look good.
right. Okay.
How does that relate to my?
Given what, this is now into the, you know, she's seen me, you know, she already explained the rationale of the program. So given that she's heard this before, you have. How would someone then explain this to her? You know, yeah.
I would like go back to the distress and all of the things that she.
So what I would probably do is just go back to the assessment phase, because that's already been done. And in the assessment phase, you were probably really open about how much this is interfering with you, and then figuring out, you know, of the various options, what would be the thing you would be willing to try. So maybe even revisiting the fear ladder, and maybe we're trying to get something that's at too high of a level.
Okay, all right.
But
Yeah, exactly. And something like, well, what we've been hearing, Barbara, is that there are many things that you believe you need to be perfect in. And this feeling that you need to be perfect is making you worry all the time. And remember, we talked about interference and messing things up, and you're it's messing things up for you. You're not doing the things you would like to do. You've already gone, and that's revisiting impairment. You always have to go back to impairment, because why would anybody ever want to change anything? There's no reason to change anything unless it's messing things up. And when things don't work for kids, or when people don't change, it's because, well, why should I? This is working for me. And they have to learn that it's not working for them. So you have to revisit why this behavior is not working for them.
If I go a day without blow drying my hair, it's not going to be so bad as I think it's going to be. Nobody will notice, but you.
But I'm not going to say that. I'm going to have her go out and see it.
Right.
And I'm going to say, well, I want you to see, I don't know what's going to happen. I have my theory about what I think will happen, but I want you. See, now I could say no one's going to notice, but I'm going to say, I have my own theory, I have my own ideas, but I want you to see yourself and for you to see what happens. So would you be willing then to give up, how many days would you be willing to give it up, Barbara?
Depends on the day.
Okay, well, it's the first meeting, so which day?
When do I have to see you again?
Well, today's Monday, I'm going to see you next Monday.
Okay, well, I guess I could go without doing it for like 2 days.
Okay, so pick your day.
Not Friday, not Saturday.
Okay,
I
not,
would have to do it on Friday, Saturday.
oh, okay.
What I'm saying is I like to look good on Friday, Saturday.
Okay, so these are the days, okay, I'm mixed up on my X's and my checks. Okay, so Friday and Saturdays, you need to do it, and everything else,
Well,
okay, and you're willing to give it up all these other days?
no, I want to watch it Wednesday because I have to do something at school. I have to give a presentation.
Okay, so you need to do it on Wednesday, and you need to do it on Friday, and you need to do it on Saturday. Are you ready to give up Tuesday, Thursday, Saturday, and Sunday? I'm sorry, Tuesday, Thursday, and Sunday?
I could try.
Oh.
I could put it in a ponytail or something.
You can try.
I can try.
Now, let's talk about what we can do to try to make this work. Okay, because you say you're going to try. Well, I want to know more specifically how you're going to try. What are you going to do?
I'll get some cute hair accessories.
Okay. See now, because this is other things you can do. So you can get some nice, maybe those little crunchy things. Scrunchy. Oh, you like scrunchies?
Crunchy.
What is it? What? It's, oh, okay. Okay. Scrunchy. Okay. Okay. So, okay. All right. Now, so you can do, but so maybe some of those scrunchies, or maybe like a headband or something. Or, yeah. What do you? Something like that. You want to try something like that? A scrunchie?
Okay, I could do that.
Because maybe if you put the scrunch, that might help. You think?
Okay, yeah, I can see if it will look good that way.
Okay. All right.
And if not, I'll wear it.
Okay. Okay.
So why don't you shift from thinking to exposure? 'Cause we were talking about thinking, and we got into.
Because I think trying to get into a debate with her about about her perfectionism, blah blah blah, and it's too and that's why. But you have to realize I'm more of a. It's my experience that I find that you need to get the kids to go out and get some evidence. And it's very hard for me to get the evidence that she's not going to graduate, because graduation is 3 years from now. So I'm thinking, okay, well, I can't sit here for an hour trying to tell her she's not thinking right. I can point it out to her, and she got it. But as I said, I had one of my things is just telling people they don't think, we talked about this earlier, just in my opinion, personally and professionally, just being, so I'm switching that to a behavior, and she can get some evidence that her perfectionism, because then what I would do is this. She comes back, she does it, I go, so how did the week go? And be honest, nobody's going to know. You don't make it like someone said something about your hair, because they didn't. No, I'm not saying, I'm talking to Barbara now, the role player. Nobody said anything.
No, it felt greasy.
Okay, but did anybody say anything?
No,
Okay, so I guess I'm wondering now, Barbara.
bugged me.
Huh?
Nobody said.
Okay, it bothered you. But I guess I'm wondering now, so I'm wondering now, we started this because we started talking about graduating and getting all A's
Right.
and what it means. And I guess I'm wondering, do you see any connection between what we did this week with the hair and this thing that you need to always get B's and be, I'm sorry, always get A's? I guess it's Friday afternoon, okay.
Yeah, I do.
Okay, well tell me what you see the connection is.
I didn't wash my hair, and I mean, it made me not look as good as usual, but in the grand scheme of things, I had a normal day. Nothing
Okay.
terrible happened, nobody refused to talk to me. I get it. So you're saying that if I get a B, nothing really terrible is gonna happen because I got a B.
Right.
It can just be,
Right. And now, and I'm not going to lie, don't think it's always one trial learning like this. This is why sometimes you say, okay, and she might say, but I still don't really believe it, and then you say, well, I understand that. You've been thinking this way for 14 years. I understand that. We need to keep practicing exactly what we're doing. We need to keep doing this and getting evidence and getting evidence. And sometimes, and then the other thing is, I think the other thing is back to the thinking, and then these are some other questions, by the way. Like, even, by the way, Joe, if you wanted to go, I'm sorry, oh, God, Terry, if you wanted to go with, Terry, I'm sorry. It's Terry. His name is Terry. So Terry, by the way, I'm not saying you can't do this because we could have asked, has this happened to anyone I know? You could keep probing that. There are other people who graduated who didn't have these. So you can do that. It's just a matter of personal preference. I happen to like being more behavioral and cognitive rather than cognitive and behavioral. But it's just your own. But that's because I've been doing this for so many years, and this works for me. Yeah, so, yes.
You can have them experience the, I'm afraid of what other people are going to say by going through it and seeing that no one says something,
Right.
or making it so someone does say something and
Exactly.
then you process it.
Exactly.
But what about what other people are going to think? How do you get into proving one way or another or experiencing people's thoughts, other people's thoughts? You make them say them? I don't know. That's why I'm asking you.
That's what that is. Okay, so let me,
But how do you
okay,
expose them
no,
to
this is
it?
what I do. I say, okay, what's your name?
Allie.
Allie. What number am I thinking of right now? That's what I would do with the kid in the session. Okay, Allie, you say that the people are thinking, oh, she didn't wash her hands. You think those people are thinking that.
Well, no, can we work with the one I'm thinking of?
Okay, no, but that's just.
Yeah, 'cause I have a really
no,
good
but
one.
listen to me.
Okay, I'm listening,
So
I'm
you're
listening.
saying, Allie, so you think that the people are thinking, oh man, Allie didn't wash her hair.
Mhm.
That's what I heard you say.
Mhm.
So what number am I thinking right now?
Well, I know you're thinking 8.
No, I'm not thinking 8.
It was 2.
No,
Yes, it was.
no, it wasn't. No,
7.
no.
4.
Okay,
you're not the mentalist.
so, okay, what am I eating tonight for dinner?
I'm getting a very strong sense of corned beef on rye.
Okay, these are exposures. I'm doing, a lot of times we think about exposures as staying there as scared as possible, because a lot of it is. But I also said with the thoughts, a lot of it is experiments, and okay, I'm doing an experiment now. Read my mind. Tell me what I'm eating, okay? Or tell me what I'm, so that's how I would handle that. Okay?
So it's all the cognitive then. You can't really do the exposures for that.
Well, it is an exposure.
Did you ever go to
It is an exposure.
But sometimes the
I mean,
kids are.
it-
Sometimes Sometimes the kids are thinking.
Okay.
That you smell or
Right.
you're fat or
Exactly.
whatever.
So they are thinking that.
Right. And then
They
you
are
need to just
thinking.
deal with that.
They are thinking that. And then it gets to, okay. But first of all, sometimes they are thinking and sometimes they're not. And sometimes the kids are over-exaggerating or magnifying, what they're thinking. And then when they're doing that, sometimes a lot of it is learning to teach the kids that they learn, it's like, this thing that you can't be, that what,
Everyone's
so,
not
so,
gonna like
and, yeah.
You can't control what other people think. It's a self-dialogue.
Yeah.
Mhm.
You're telling yourself
Yeah.
that that the other kids are thinking. So you have to change what you're telling yourself too.
Yeah.
Right.
I mean, we can't change what the other kids are doing, but all we can do is help the kids learn to better handle what the kids are doing.
Yeah.
You know, but you know, and that's what it is. I mean, but that's what it is. Yeah.
I was just going
Yeah.
to say that what I have found.
I was just going to say that what I have found is it's not so much the kids thinking that's the problem, it's these traps that's the problem. So even if they do get negative feedback, like you're saying, they then
Right.
fall into a trap because they overgeneralize
Right.
it or they catastrophize it,
Right.
and it, you know, and so that's usually what the issue is.
That's right.
And what I usually do, which you know, I'm open to doing more behavioral, but I usually try to help them come up with more like coping thoughts or
Right.
like what else could you say to yourself or what, you know what I mean?
Yeah, well, that's
Like-
all. I mean, that's other things I do. I mean, I do that too. Don't get me wrong. I do it too. But then I also then go out and do it.
Yeah.
You know. So I agree with you. But I don't just like to sit in the office and say, okay, what are other thoughts and other things you can do? What I would do is, okay, so now next week I want you to go and do this, and I want you to come back and show me if O worked.
Right. Okay.
I just want them to try to provide as much evidence as possible, because you know, I'm saying this because I have found, I've been doing this for so long, and I, you know, used to not be so into trying to get the evidence, but I have learned that if you don't get the evidence, it gets to be more that parroting kind of stuff, and they're just saying this, but it's still, you know, a very ingrained feeling, intense feeling of anxiety that's in there, you know, and it has to really get out. You know, it has to get out, and they just have to get the evidence, and then they learn it. Yeah.
I had another question, but it's not related, but I'm just realizing we're running out of time. So do you want me to just wait and ask it later?
Well, it depends what the question is.
Well, the question is just about, you know, someone had mentioned earlier about OCD, and that's something that I'd been wondering about too. So would you use do you use your same manual and all of these same techniques for
The only
OCD?
thing that's different in the treatment of OCD, and by the way, panic is the same thing. You can treat panic in the same way. So OCD, it's cognitive therapy, and the main difference is this concept of response prevention. You prevent them from doing the compulsion. So if she was compulsive with the hair stuff, we would make a contract, an agreement that she is not, I mean, she kind of is doing a response prevention. She is not allowed to wash her hair, and that's a response prevention. And with someone with OCD, you're not, you know, let's make an agreement. You're not going to, you usually wash your hands 50 times a day. Let's wash our hands 30 times a day. Let's wash it 20 times a day.
I guess what I'm
and then come up with a way, really, to prevent the response. You know, sometimes you need to really be creative on how you prevent that.
But are you using the same manual with your trainees? If the child has OCD and it's not comorbid, it's just that. Are you using the same
Basically,
manual?
yeah,
Okay.
yeah, because the treatment is the same except for the response prevention. Response prevention's not technically in the manual. Yeah. Okay. What? Yeah.
Do you ever use metaphors with
Yeah.
children?
Sure.
Some of the adult literature, they talk
Yeah.
about like every exposure is like being on the mat. It's an
Yeah,
opportunity.
she asked
to be
about
on the
metaphors.
mat.
I guess I'm not like, you know, if I'm smart enough to come up with something. I told you I'm very concrete. I'm very, very concrete. So I don't know if I can come up creatively with a metaphor that's not too abstract for me. You know, but I think it's a great idea if you can do it. Sure.
Like just one
Yeah.
could be like the carousel. You know, you get the little ring every time you go around. So like an exposure is a ring every time you
Uh-huh.
do the whatever. So like when they're resistant, like why should I skip washing my hair? Why should I whatever?
Yeah.
You know, we
That's
talked
good. I
about
like that.
this is gonna, you know.
That's good.
I don't know if
All right.
carousels still have rings, but they
That's
did
good.
when
I like that.
when I wrote them.
Okay. So listen, I really want to thank you for being a fabulous, fabulous, fabulous group. I love you guys. No, seriously, you guys